This is one of the first tests of PD-1 blockade in sarcomas, and so because the tumors are very divergent, it was unclear if it was going to work in any subtype. So the study did show that there was efficacy in 2 or 3 of the different subtypes, and what that leads to is the important question of biomarkers. How can we know who to treat and who not to treat? So we were able to bank tumor samples and blood samples, cells and serum from almost all of those patients. And we looked in the tumor. The group at MD Anderson led the tumor analysis efforts, and they found PD-1 staining PD-L1 on the tumors, and so there's some interesting findings about the PD-L1 expression levels on tumors, which was actually very low, unexpectedly low, given the clinical outcomes we saw. So it's not going to be a clean story of high PD-L1 on tumors means these are the patients who should be treated. We have to look deeper than that. We looked in the serum and we found soluble PD ligands being a correlate of good clinical outcomes. So this is a very interesting signal we're looking at. Examining soluble checkpoint molecules in serum is a new area, and so being able to look at that and see a signal is something that we're going to very much focus on in the expansion cohorts. So those subtypes of sarcoma that did respond well clinically, we're going to really be able to look closely at candidate biomarkers for them.